Small hiatal hernia normally doesn't cause health problems, and you may never know you have one unless your doctor discovers it when checking for another condition. But a large hiatal hernia can allow food and acid to buck up into your esophagus, leading to heartburn. Making a few lifestyle changes may help control the symptoms and signs caused by a hiatal hernia. However, a very large hiatal hernia might require surgery. So time to understand what hernias are, and I have Dr. Moses Ngoge and of course Diana Murithi, who just underwent a surgery to correct a hiatal hernia, and she'll be telling us more about her experience. Now, Dr. I think you can tell us, for us who are trying to understand what a hernia is, what exactly causes it.
A hernia is a defect in the wall of a compartment of the body. Our body is divided into compartments, and every compartment has its encasing substance, which we call a fibrotic tissue. So if there is a defect in that encasing or containing encasement, a defect in it cause for allowing structures inside that compartment to come out into another compartment, we call that hernia. There are so many areas in the body which can develop a hernia, depending on the weakness of that encasing fibrous tissue.
Could you touch on some of them and how they present themselves?
If we start from down in the legs, we have hernia. If the fascia crura is weak, then you can have the muscles herniating out. If the fascia lata in the thigh is weak or has a defect or has been injured, then you can have muscles herniating out. In the pelvis, we have the femoral area where the vessels come out into the leg, into the thigh, sorry. If that area is weak and then there's an opening, then we can have pelvic organs and structures herniating out. We have the inguinal area, or upper, where the waistline is. That is an area that is prone to weakness. And you have intestinal structures popping out through that area of weakness. Now, internally, there are compartments. One of them is a diaphragm. The diaphragm which separates the chest from the abdomen. If that area has a weakness or has a defect, then you can have the structures from the high pressure zone coming into the low pressure zone. The chest is a low pressure zone, the abdomen is a high pressure zone. So you'll have structures from the abdomen getting into the thorax. And that's where hiatal hernia comes about. That's how it comes about.
All right.
Yes.
Speaking of hiatal hernia, I mean, Diana, this is something that you just got corrective surgery for the same. And I was just reading up on it, and it seems that the symptoms can be pretty silent, but if it really is bad, it can mimic different other conditions. What were the symptoms that you were facing?
Shortness of breath, tightness of the chest, and now, unfortunately for me, I'm also asthmatic. So in 2005, I was diagnosed with asthma, and 2006 with ulcers. Around May, I was admitted for asthma. But all this while they were treating asthma, it was the hernia that was disturbing. Because as much as I'd been nebulized, I still feel tightness of the chest. I'll have difficulty in breathing and constant pain that wouldn't go away the middle of my chest. Mm-hmm. I also had a bulge, but because I'm a big girl, I always knew it was just me being big. Mm-hmm. But once I went in now for the second admission in June, they did an endoscopy, then they found out that I have type 3 hiatal hernia.
Oh, wow. So what are those general symptoms that could tell you this definitely is a hernia you're dealing with?
The symptoms that Diana experienced were those of gastroesophageal reflux disease. Hiatal hernia manifests is a component of gastroesophageal reflux disease. More than 60% of patients that we see with gastroesophageal reflux disease are due to gastroesophageal reflux disease. So what Diana had was a progression, maybe from early adulthood or even childhood, a progression of gastroesophageal reflux that went to a point of destroying that hiatal opening to a point of now developing a hernia.
What did the doctors think you were dealing with the first time round?
The first time it was purely asthma, nebulization, steroids. Then it reached a point, the fact that it was not clearing, they actually said it was a psychosomatic disorder.
There are some other factors here. Asthma, ulcers. Could those have aggravated the situation?
Yes. What was diagnosed as ulcers was purely a term that was not used well, because ulcers is a diagnosis that is made at endoscopy. One is able to go using a camera, identify an ulcer, just the way we have ulcers on our skin. A wound is a wound, and unless you have seen the wound, you can't claim that the patient has an ulcer. So the ulcer term was being used wrongly.
Has anyone in your family ever dealt with a hernia before, of whatever kind?
My younger brother has the hernia for the umbilical cord, but it's never disturbed him. Life is just as normal. Because when he was small, my parents were told it might reach a point, the intestines will start popping out. And if it reaches that point, then they'll have to do a corrective surgery. But right now he's in Form 4 and
He's still okay.
he's still okay.
Is age probably a factor in as far as complications are concerned?
Age is a factor. As I've just alluded to, the progression of the pathophysiology of hiatal hernia is it revolves around one weakness of that hiatal. Hiatal means an opening. That opening which allows the esophagus to pass through the chest, okay, from the abdomen. So that opening is naturally tight. As one advances with age, there is some element of weakening. So there is a phrenoesophageal membrane which covers the esophagus to protect it from pressures. And that ligament or that membrane becomes shortened and it becomes thin. So as it thins out, that area becomes now more open, and you find now the esophagus can easily be pulled up into the chest. So age is a factor.
And you're a mother of how many kids now?
3 lovely boys.
3 lovely boys. I wonder, did the doctors maybe think that could also have been part and parcel of the herniation to present itself at this point?
At no point did they mention that pregnancy or getting babies was an issue. But I used to have a lot of heartburn when I was pregnant. A lot of it.
And it's interesting, when we're pregnant, we're told if you have heartburn, the
It's
child
too much
has
hair.
a lot of hair and all that. But that's just laymen thinking about these things. But Dr. there are other risk factors: obesity, pregnancy, and what have you. How do they relate to herniation?
When it comes to hiatal hernia, the pregnancy and hormones associated with pregnancy do not seem to play a big role with the hiatal herniation. Even with in terms of weight, you find that people who are obese are more prone to formation of hernia as opposed to the ones who are less obese. So in terms of weight, it has a contributory factor.
Men or women who are affected more by herniations?
When it comes to the basic sliding hiatal hernia, the gender or sex is not a difference. But when you now go to the paraesophageal hernia, that's when you have now bias towards women. You have more women with paraesophageal hernia than men. But when it comes to the sliding hiatal hernia, they are in equal proportions. Yes.
So at this point, we take a short break. When we come back, Dr. Ngugi will explain to us how the diagnosis is done and, of course, the progression of treatment for hiatal hernias. Stay with us.
hurt?
Yeah.
Does your toothpaste contain sage, eucalyptus, myrrh, chamomile?
All that in one toothpaste?
Yes, try Colgate Herbal. Colgate Herbal contains nature's best herbs and Colgate's fluoride technology to give you strong teeth and healthy gums.
Ah, Colgate Herbal.
Let's go. Colgate Herbal for strong teeth and healthy gums naturally.
COVID-19 waste disposal tips. Separate or segregate the waste at source. Use biomedical waste bin liners. Use licensed NEMA biomedical waste handlers for transportation. Use dedicated vehicle to collect COVID-19 waste. In rural areas, disinfect the COVID-19 waste before disposal.
It is important to note that proper waste management is an essential public duty in the fight against COVID-19.
NEMA, mazingira yetu, uhai wetu, wajibu wetu.
Explorers of the night, wale wase wa kuhustle usiku, kustreama movies, music mix diehards and gaming fanatics. We've heard you. It is now your time to fly your flag high. Do what you love, mpaka che na Telkom. Join Usiku Sako with Telkom night bundles that allow you rule the night at prices you love. Join our tribe, Usiku Sako Squad. Just dial *544# from your Telkom line and select the night bundle of your dreams. You are the legend the night needs.
This is NTV.
Hujambo mtazamaji, hizi ni baadhi ya taarifa tunazo kuandalia kwenye NTV jioni.
We agreed on 6 key parameters that are a basic minimum that will determine whether we lift the containment measures or not.
Wizara ya Afya sema imejipanga kudhibiti maambukizi mengi ya COVID-19 endapo rais ataondoa marufuku yote wiki ijayo.
Alikuwa ametutumia picha za watoto. Kwanza nikashangaa ametuma picha kwa nini? Halafu akasema tuombee watoto wake maana amewaua.
Polisi wanamzuilia mama aliyewapa sumu na kisha kuwanyonga watoto wake 4 huko Naivasha. Viongozi wa kidini wapinga mswada wa afya uzazi wakidai utafungua milango kwa uozo wa maadili nchini. Na wanafunzi 129 wa Kenya waliokuwa wamekwama Sudan wawasili Mombasa na kuwekwa karantini kupimwa COVID-19. Na mtazamaji, kwa taarifa hizo na zingine usikose kuungana nami mwendo wa saa 1 kamili.
Nilikuwa nataka kupoeshea customer chai sababu unaona
Amekuambia mpoeshe?
Chapati ndio hizo nimekujenga. Yote inaweza kuwa 270. Kidogo tu niwashe moto ya githeri. Na hiyo moto iko lit. Mumeget hiyo. Na hiyo moto iko lit. Utadhani ni 2020.
We want you to relax and feel safe in your own home, at the office, in a restaurant, at the salon, or any public space that you visit. Ace Cleaning products are a sure way of feeling safe and secure in your home.
Welcome back to Health Diary. We are still speaking about hiatal hernias, and I still have Dr. Ngugi and of course Diana with me on set. Daktari, I have to ask, when somebody comes and we've had of the misdiagnosis and you have an idea that this could be a hernia, what is the diagnosis look like?
When a patient comes and has symptoms that are suggestive of possibility of a hiatal hernia, like we have had a respiratory system presentation or ENT presentation, or just features of dyspepsia where there is a lot of bloating, acid and bitter taste in the mouth, and water brush, or when all that is coming as a presentation, it is very important for the diagnosis to be ascertained. And diagnosis is made. There are several modalities of making the diagnosis. We have the old method of making diagnosis, where a patient would be made to swallow some contrast, call it barium swallow, and then an X-ray is done, and it was able to make a diagnosis, but the sensitivity is quite low because it requires a huge defect for it to pick. So the sensitivity is to the tune of 60%.
And when you say swallowing, is what? Swallowing
one
water?
Is given some material, some medicine to swallow, and that medicine is picked by the X-ray, and one is able to see the defect through an X-ray. That is a conventional way of making the diagnosis. But the modern way is using the video endoscope, where we have a camera which is connected to a tube passed through the mouth, and one is able to examine the esophagus, just as we examine the outer part of the body, but now using a camera all the way down through the esophagus, stomach, and also duodenum. And now a diagnosis is made at that level.
Okay, so did the endoscopy take a while before it was done, because the misdiagnosis went on for over 2 months, right?
Yes, I was in hospital. I stayed home for another month. Then when the symptoms came again, I decided to go to a different hospital because I didn't want to be admitted. But when I got there, my chest was really tight. I couldn't breathe. I was in a lot of pain. So I just saw a general physician. Then she looked at all the tests that I'd done. Then she suggested, since all this have been done apart from the endoscopy, let's do the endoscopy just to see if any gastritic issues that's causing you to get worse. So they did the endoscopy. I think it took around 30 minutes or so. Yeah.
And they had the right diagnosis.
And I was told it's stage 3. And the surgeon actually suggested that we do surgery to correct it. But the physician recommended I take some medication for a while just to see if it will make it better. But went home for another 2 weeks. The symptoms are still the same. So my husband and I opted to do the surgery.
The treatments, we have both surgical and medical management, and different patients would fall into either of the two. There are those patients who would come to us with characteristic presentation where we have esophageal injury in the background of a sliding hiatal hernia. So we go straight for surgery. But there are those patients who would present to us with a hernia, but with minimal or no esophageal injury. That means the esophageal integrity is good, and the symptomatology is also minimal. So we do what's called medical management, which entails lifestyle modification and drug and some proton pump inhibitors. So if that one, for most patients who are at that group category, they improve. And if there is remission for a period of 2 years or more, that is good. If there is a relapse within a very short time, then we consider going to the next mode of management, which is a surgical therapy.
Okay, and speaking of relapse, Diana, earlier on you were saying you had been told that there is a chance of recurrence?
Yes. I've read about it, I've been told. Even the time I was actually filling the forms, one of the doctors told me, what's the point? And within around 10 years, it will be back to where you are. So for me, I was just tired of taking medication. I've been in and out of hospital. So it was the quickest way out to relieve my pain. The recurrence after surgery is very minimal. The discussion about expecting it to recur so soon is not true. If you are the correct candidate, that means the esophageal integrity is good, the esophageal motility is good, then the surgery it becomes the gold standard. Once the operation is done and the healing has happened, now the issue of aging, okay, and all those changes that come with age will also happen, just as in the normal population. Yes.
you are not exempted from aging, and therefore you expect some change to happen, but it's unlikely that you will have symptomatology. Yeah, so the presence of a hernia doesn't mean disease. No.
Okay. Daktari touched on the fact that you also have to do some modification in terms of your diet. Have you done that, and has it helped with the reflux especially?
I try because I have to eat smaller portions, which actually helps me in the long run, because I can't eat a lot of food in one sitting. And then I take a lot of water. Water was my major issue, so I have to take a lot of water to help it go down. Then fatty foods I avoid. I still eat, but in minimal quantities. Acidic foods I completely avoid.
Okay, so Daktari, what would
I think
you
she is
suggest?
training herself too much.
Really?
Yeah, all that dietary modification is for patients who have gone the medical mode, where there is no surgery. After you have had surgery, then you should live a normal life, because there is no reflux. So I don't expect any refluxation. So the high fat diet, high meal, or even heavy protein meals, which stay in the stomach for so long, for you now there is no fear of refluxing. So you should be able to enjoy your meals like everybody else.
So I guess then the question would be, are there foods that aggravate a hiatal hernia that we should stay away from?
The answer is no.
Okay.
Yeah.
Interesting. All right. So are there home remedies maybe that can help control some of the symptoms, like now the acidity that she has?
One is to ensure that you do not take very heavy fatty meals, because the fat make the food stay in the stomach for so long. That means you produce a lot of acid, and therefore propensity to reflux very high. If the low fat diet and fairly low amount of proteins and high carbohydrate diet, you find digestion is faster, the acid production is less, and therefore you have fairly an empty stomach, and that will allow that valve to remain tight. Because once the stomach is collapsed and the valve is still intact, then you'll have minimal reflux. When the stomach is full, there are those people who overeat. Yeah, that is still another factor. There are those people who overeat. There are those people who swallow a lot of air. Okay, so those are the people who are predisposed to the reflux disease and development of hernia, because of having a huge stomach, which is always so full, and therefore the esophagus is tagged on a full stomach, and that allows reflux.
Okay, so right now, at least so far so good for you, Diana, and the surgery has come a long way in helping relieve your symptoms. The treatment, it had a price tag to it, yeah? Did you have, did insurance help, NHIF?
Since I was admitted for quite some time, we had exhausted our cover, so we had to wait for it to be renewed, and again we had to dig into our pockets. NHIF came in handy. It sorted part of the bill, and then insurance paid a certain amount. So yeah, it's quite expensive, especially if you're in and out of hospital and you don't know exactly what is happening. Yeah.
Okay, Daktari, at least she got the chance to go to a hospital and get the right diagnosis. There are people who might get the right diagnosis but don't have the resources to pay for the treatment of the same. How does that look like, especially in public hospitals?
I think the scenario is not very good, especially when it comes to diagnosis. The centers in our country who are able to do the upper endoscopy are quite few. The expertise, the number of doctors who are able to competently make a diagnosis of hiatal hernia, quite few. We've had quite a number of misdiagnoses in terms of overdiagnosis. Overdiagnosis. Those are challenges that we are experiencing, but as practitioners, we go through proper training, and then we need more investment in public hospitals so that we can have these diagnoses made at the even level 4 hospitals. At the moment, we are talking of only a few level 5s, usually level 6. And you find even in level 5s, we have challenges in arriving and banging on the diagnosis. Yeah, so it is a challenge. Diagnosis is a challenge. Once the diagnosis has been made, the treatment is fairly straightforward. Because, for example, we have the NHIF is able to cover or to step in For those people who are non-civil servants, you find the cover is not complete. It's just a good amount of it will be covered. In the general side of the public hospital, they cover fully. For the people who get to public hospitals through the private wing, those are the ones who have to subsidize out of pocket.
Right. I think I've learnt a lot today because I've heard of hernias, but I did not really understand what exactly they are, and especially now a hiatal hernia. And Diana Murithi, thank you so much for sharing your story. She underwent surgery to correct a hiatal hernia. And of course, Dr. Moses Ngugi, thank you for your time. And the many other hernias, as the Daktari mentioned, and we will take time to find out how each affects you and how the treatment can be done of the same. Time now for the health tip.
If you have natural hair or relaxed hair and you want to do protective hairstyling, most of the things that we do as protective hairstyling is things like doing cornrows or doing braids or weaves, just to cover your hair and stop exposing it either to the climate or a lot of activity, mechanical activity on the hair, which could cause damage. Now, if you want to braid your hair, it is important that the tagging or the pulling is not done tightly, because this would cause another form of hair loss called traction alopecia. On the same breath, if you have you're doing cornrows or you're doing weaves, it is important that they are not tightly secured. And if you're weaving your hair or doing wigs, make sure that they are not heavy, because if they are heavy, then they put so much tagging on your hair and then you end up losing your hair.
The conversation has been hiatal hernias. Thank you for all your questions and suggestions coming through on our social media handles. Until next time, see you. My name is Gladys Gashanja, and we've been coming to you from the Grammar Suites here in Nairobi. Sawa. Okay, I think we're good now. How the world works.